Chiropractic care focuses on diagnosing, treating, and preventing mechanical disorders of the musculoskeletal and nervous systems, especially the spine. The goal is to restore normal function to the spine and joints, alleviating pain and enhancing overall health through natural, non-invasive treatments. Chiropractic adjustments offer pain relief for back, neck, and joint pain. They improve mobility by releasing tension and restoring joint function. Additionally, chiropractic care enhances nervous system function, improves posture, and reduces reliance on pain medication, providing a holistic approach to health. Becoming a licensed chiropractor requires extensive education, including undergraduate coursework, a Doctor of Chiropractic degree, and clinical internships. Chiropractors possess specialized knowledge in anatomy, physiology, and biomechanics, ensuring safe and effective treatment for patients. Chiropractors address spinal misalignments, chronic pain conditions like sciatica and arthritis, and aid in injury rehabilitation. Techniques include manual adjustments and specialized tools to restore proper alignment, significantly improving patients' symptoms and quality of life. The process begins with an initial consultation, including a health assessment and physical examination. Chiropractors develop personalized treatment plans and provide ongoing care to prevent future issues. Regular follow-ups and lifestyle advice support long-term well-being and optimal health.